Good day, I'm Dr. Magpantay, your obstetrician for today. Please feel free to interrupt me if you are uncomfortable or if you have any questions. So ma'am, to start, I will just ask you some general questions. What is your name, age, birthday, gender, address, civil status, nationality, religion, and contact number? So those are for the identifying data. Now we go to the chief complaint. We were given a scenario, a 20-year-old female G1P0 with a chief complaint of 8 weeks amenorrhea and positive pregnancy test, who came to our clinic for prenatal checkup. So we will ask, Ma'am, what brought you here and how may I help you? Next is the history of present illness. We will ask, Ma'am, what are the symptoms when you decided to have your pregnancy test? And when was the pregnancy test done? I would just like to ask, when was the first day of your last menstruation? Is this your first prenatal checkup or you had your consultation before? And if there is a consultation before, where was it done? In hospital or in a center? And if you are already given any medications or multivitamins, and if you are able to take it regularly, and if there are labs done aside from the pregnancy test such as CBC and urinalysis. If none, so as I computed your age of gestation, so your age of gestation via your last menstruation is this. And your age of gestation via ultrasound, as you have shown me a while ago, is this. And you are expected to give birth on. Next, we go to the past medical history. We will ask, Ma'am, do you have any history of hypertension, diabetes, asthma, cancer, any allergies, or surgeries done before? Were you admitted? For what reason? And how long did you stay in the hospital? Were you able to take the home medications and return for follow-up? Any childhood illnesses such as chickenpox? And at what age was that? Next is we go to the gynecologic history. We use the MIDAS format. So M stands for menarche, I stands for irregularity or regularity, D stands for duration, A stands for amount, and S stands for any associated symptoms. So for the menarche, we will ask, Ma'am, at what age was your first menstruation? And then, for the irregularity, we will ask if you have menstruation every month. Is your menstruation a 28-day cycle or less or more? Next is the duration. We will ask how long is your period? Does it last 3 to 5 days or more? Next is the amount. How many pads you use? Is it a regular one or the night pad? Is it fully soaked or just mildly soaked? And then for the symptoms, do you experience any dysmenorrhea or premenstrual syndrome such as mood swings? Next is for the sexual history. Ma'am, how many partners do you have? And if it's okay to ask, when was the first coitus? Do you have any sexually transmitted disease? And whenever you have sexual intercourse, is there any post-coital bleeding that you have observed? Now we go to the obstetric history. So we ask for the gravida and para as well as for the TPAL score. But in our patient's case, since this is her first pregnancy, so we only have the gravida. The gravida means how many pregnancy already the patient has, and for the parity, how many deliveries. And then for the TPAL, T stands for term, P stands for premature, A stands for abortion, L stands for live. So for our patient, we have G1P0 as the OB score. So if the patient has a previous delivery already, so we will ask, was it term or preterm? The method of delivery, was it NSD or CS? If CS, what was the reason? And then where was it done? In the hospital or just in a lying in? Who attended the birth? Is it a doctor or a midwife? And then was the baby alive or stillbirth? And if it was a girl or a boy, and if the mother could remember, we can also ask for the birth weight. And then last, for the complications. So we will ask, Mom, was there any blood transfusion done when you gave birth? Or was there any complication in the birthing process? Did you go home the following day or you extended your hospital days? Next is we go to the family history. So we will ask, in your family, is there any history of hypertension, diabetes, cancer, asthma, any hereditary or genetic disease? Next is we go to the personal and social history. We will ask, Mom, do you smoke? And how many sticks? Did you stop smoking when you knew that you're already pregnant? Do you drink wine or beer? How many percent alcohol? How frequent? How many bottles or glass you drink? And did you stop drinking when you knew that you're already pregnant? Next is the diet. Mom, do you eat more of meat or vegetables? How about sugary or sweet foods? And then we will also ask, Mom, what is your occupation or source of living? And then during the pregnancy course, were you exposed to any stress-related events? And also, don't forget to ask, Mom, do you exercise? And what specific exercise is that? Is that a simple walking or it's more of dancing? So we will ask the specific type of exercise. And now, for the last, we will go to the review of system. We will ask, Mom, please tell me if you had any of the following: weight loss or weight gain, fatigue, fever or chills, weakness, trouble sleeping, rashes, headache, difficulty of breathing, loss of consciousness, palpitations, depressions, memory loss, nervousness or sweating, feeling of thirsty, change in appetite, muscle pain. So that would be all for our history taking. And then we will thank the patient. Thank you, Ma'am, for cooperating. Is there any questions that you would like to ask me? Rest assured that the information you gave me will be confidential. That would be all. Thank you so much and God bless.